Is it RSV or is it a cold? RSV, or respiratory syncytial virus, is a virus that mainly affects the lungs and the airways. It really is like a bad cold, but it can be more serious, especially for babies and young children and men and women that are over the age of 65, or anyone with a weakened immune system or certain medical conditions like asthma or heart problems. Now, RSV usually appears as runny nose, cough, sneezing, fever, sometimes wheezing or difficulty breathing that I like to call SOB. Now, if you are experiencing shortness of breath, this can be a very serious symptom of RSV. Now, although there is no specific conventional or mainstream medicines for RSV, as a naturopathic doctor for over 20 years, here's what I would recommend to my patients to help them naturally overcome RSV. This is my own unique blend of natural medicine and evidence-based care that can help someone with RSV feel more comfortable and get better faster. You're going to need supplements that support lung health. N-Acetyl Cysteine is a supplement that helps thin mucus, acts as an antioxidant, and is useful for supporting both lung and immune system function. Now, Quercetin is a supplement that would be my next recommendation. It's a plant-based compound that reduces inflammation and supports the immune system. Now, it can be a little difficult to find some of these in stores. You can definitely order them online. Reputable health food stores will always have these. Get them from a trusted company. Now, because your body is working so hard to fight that virus off, you also need herbal and nutritional support to strengthen the immune system and reduce those viral symptoms. That's where I'd recommend elderberry, which is also known as Sambucus nigra. It is known for its directly antiviral properties and can shorten the duration of respiratory infections, including RSV. It's great as a tea, it's great as a gummy, or as a capsule in powder. Echinacea, a famous immune-boosting herb that is known to help the body fight off infections and shorten the duration of colds and flus. You can take it as a pill or as a liquid supplement, or it's also fine as an herbal tea blend. Licorice root, a plant called Glycyrrhiza glabra, you'll see that on the bottle. That's another one that can be taken as a pill, in a supplement, or as a tea. Licorice root helps soothe inflamed airways and has antiviral properties. Use caution using licorice in anyone who has high blood pressure. And now we come to vitamin C, of course, helpful in boosting the immune system. And then onto vitamin D, the next letter in the alphabet, common for older adults to be deficient in vitamin D, which is linked to a higher risk of respiratory infections. So supplementation may be needed based on laboratory levels. I recommend getting your levels checked by your primary doctor before you start a supplement and for monitoring. And then we move on to zinc. Zinc is a really powerful mineral that's essential for immune system health, has been shown to reduce the length of respiratory illnesses. Now, as I mentioned earlier, RSV is like a really bad cold, so you want to include the common remedies that you would follow just as if you had a cold. Getting lots of rest, allowing your body to focus all of its energy on that fight against the virus. Hydrating with warm liquids like the herbal teas that I recommended earlier, chicken broth, bone broth, vegetable broth, miso. These are excellent for your upper respiratory tract. You can also just do warm water with a squeeze of lemon and some honey, which can really soothe the throat, soothe the upper airway, and keep those mucous membranes moist, making it easier for you to breathe. And then you can do steam inhalation. That's another way to break up that mucus in your chest. You can do that in a hot shower, or you can do a steam inhalation by breathing in the steam off of a recently boiled pot of water. Either way, you can enhance the effect of that steam by adding essential oils like thyme or eucalyptus to it. I can show you exactly how to do that in another video later on. But most importantly, while fighting RSV, your body is also experiencing high levels of inflammation. Now, inflammation is your body's way of protecting itself when something is wrong, whether it's illness or whether it's injury. So in this case, when your body is fighting a virus, it's sending out a message, and that message says, hey, I need help here, and your immune system is responding to that message by sending special cells, in this case, to your lungs and airways, to the area to help fight that virus. So what you put into your body during this time is critical because food has a direct impact on how your immune system functions. Now, I have a list of inflammatory foods that you will want to avoid here in this video. But during this time when you are sick, you will want to prioritize a whole foods diet that is rich in fresh foods, rich in vegetables and high in lean, healthy proteins. The nutrients that are in these foods will help provide fuel to your body that is needed to support your immune system. And you're going to want to focus on foods that are rich in antioxidants like berries, leafy green vegetables, citrus foods. Those can all help to reduce inflammation. Now that is my integrative regimen that works with the body's natural recovery process and respects the limits and the vulnerabilities that can come with age. Now for someone 65 and older, you'll want to closely monitor for any signs of complications like pneumonia or severe difficulty breathing or shortness of breath. And if your symptoms worsen or if there's a very high fever, rapid breathing, or any kind of chest pain, seek medical attention immediately. Now, as a naturopathic doctor, what I teach my patients is the knowledge to use food and holistic or herbal remedies to treat common illnesses, but you also need to know when conventional medical care is necessary. It's the balance between those two, that holistic approach and that conventional approach, that leads to a safe and effective treatment plan for you or anyone in your family. Because the most dangerous thing about RSV is how it masks itself as just a little cold. Now, the average healthy person between the age of 12 and 50 years old may not suffer at all from the severe symptoms of RSV, may not show any symptoms whatsoever. Maybe they just have a runny nose, but no other symptoms, or a little cough just because of the cold air. Now, this person may not stay home because they feel fine and they're actually carrying the RSV virus and spreading it to other potentially vulnerable people. And that's what makes RSV so dangerous, is how it is spread and what puts the babies and the elders at risk, especially around the holiday season, because typically around the fall and the winter months is when RSV begins to spread. So what should you do to avoid this? Well, you want to strengthen your immune system with vitamins, minerals, and wholesome foods. You want to eat clean and healthy. You want to stay active by going on daily walks and standing when you're working. And hydrate, rest, stay healthy, and take care.